show, Tea Talk, Real Talk, Conversations Over Tea, where we speak to our guests about different topics and issues that matter. So today we have a guest that will be talking about midwives. Linda, thank you so much for coming on the show.
Thank you for inviting me.
Yes, I just thought it was very interesting in what you do, so I wanted to bring you on the show so you can talk about midwives, because I'm sure there's a lot of people that would love to hear or learn about, what it is that midwives do.
Well, thank you, Sharon. I'm so glad that you could bring me on today. Thank you.
You're welcome.
So as you probably remember, I'm the president of the New Jersey chapter of the American College of Nurse-Midwives.
Yes.
There are over 150 midwives in the state of New Jersey and over 13,000 in the United States.
Wow.
So the National College of, the American College of Nurse-Midwives is actually one of the oldest women's health organizations in the country because we've been taking care of women and helping them give birth for many, many years in this country.
Right. Wow, that's incredible. And when you think about it, before hospitals, how were babies being born? Probably from midwives.
Absolutely.
Right?
Absolutely.
And then when hospitals came, then a lot of that probably eased up. So.
Well, most midwives in the United States right now actually do attend birth in hospitals.
Mm-hmm. Oh, okay.
Okay? People think that all midwives attend birth in the home, and although we do, and some people think that it's not legal in New Jersey to give birth at home, but it is.
Okay.
There are several practices in New Jersey, probably more than 40 practices of midwives in the state.
Okay.
Most births are done in the hospital, but many of the practices also have the home birth component. The thing about midwives is we work with women to help them to have the kind of birth experience that they want.
Right.
So whether that's in the hospital or at home, we can work with them to see that their birth experience is a good one.
Oh, wow. Wow. And so you're saying now, so what's the percentage approximately, and it doesn't have to be exact, of how many people are doing it at home versus in the hospital?
Probably about 95% of the births we do are in the hospital, somewhere between 90 and 95%.
Right.
And so the other maybe 10 to 8% are in home or in the birth center.
Right. Okay. That's nice. That's very interesting. So what made you get involved in that? I'm just curious.
Well, way back when I was in nursing school, and I did, maternity nursing and witnessed the first birth. I just thought it was such a magical and wonderful process, and I just fell in love with it. And what drew me to midwifery, to being a midwife, is that midwives, the word midwife means to be with woman. So the difference is with midwives that we spend a lot of time with women that we take care of. We're with them through the whole labor process. And then we assist them to give birth. And I saw that giving birth could be such a powerful experience for women.
Oh, it is.
Empowering.
It is.
When you've given birth, you just feel like I could do anything. You're tired.
Yeah, that's true.
You're tired, so true. But you very often feel like on top of the world, very excited, just not holding this baby, but look what I did. I'm so powerful I did this.
Right. And I'll be honest, when I had my child, and I was very young when I had my first child, but I was about 22 when I had my son. And it was so amazing. You just, like you said, you felt, wow, like this was like a big, huge accomplishment to carry the child for 9 months. You feel it in your body. And then here's this beautiful being. So it is very, very empowering, So I can imagine the joy that you get to see and help someone to bring that joy out into the world as well.
Absolutely. There's nothing like it.
Yeah.
And then the other thing about midwives is we take care of women throughout the life cycle. So people think, well, a midwife just takes care of pregnant women and delivers babies. And although that's our primary focus, we also do follow up women's health care, see women for their checkups every year. Take care of other issues that women have, birth control and that kind of stuff.
Oh, I didn't even know that you guys go to that extent, which that's really wonderful. So you basically get to see the child from birth until they probably get to be 18 or whatever, if, depending on if you still have that relationship with that client.
I've had clients where I've taken care of the mom, delivered the baby, and then when the baby's a girl and the mom brings her back to me, then when she becomes a teenager and she needs a GYN checkup, and so I take care of the family. I've had whole families, the
Wow.
one woman, her sister, the daughter.
Wow.
So it's kind of a
Right.
family
Yeah,
affair
that's
very
awesome.
often.
Wow. Wow. That's really, really interesting. So now, how long have you been doing that?
I've been a midwife for 39 years. Next year will be 40 years.
No way. You don't look over 25, Linda. Come on now. Wow.
Yeah, yeah.
Wonderful.
I've been doing it a long time,
Wow.
and always in New Jersey. I've been
Okay.
a midwife in New Jersey. I've worked in several settings, and midwives work in a lot of settings.
Okay.
We work in clinics. We work in like federally funded healthcare clinics, trying to help women that may not have access to the best care in other situations.
Okay.
Planned Parenthood clinics.
Right.
I ran a big practice in a hospital here in New Jersey, and I've been in private practice as
Oh,
well.
wow. That's wonderful. So I was reading, and it says CMA and CMs. Now, what's the difference between those?
Okay, well, the American College of Nurse-Midwives is the large organization, and there are two kinds of midwives in that organization. CNM is a certified nurse midwife,
Okay.
and CM is a certified midwife. Our basic education is the same. The difference is that before you enter the midwifery educational program, you're a nurse, you come out to be a CNM,
Okay.
and if you're not a nurse, you come out to be a CM. But we both types of credentials. Both of those people would have the same kind of education and pass the same exam, sit the same board exam.
Okay.
It's a national board exam that we all have
Right,
to
right.
pass.
Okay, so they're about the same length of time as well?
Yes,
Oh,
it's the same length of time.
Okay, wow, that's interesting. So where do you prefer to do it in terms of in the home or in the hospital?
Well, most of my all of my practice actually has been in the hospital.
Okay.
I personally haven't done home births.
Oh, okay.
But that, it's a personal
Right.
preference for each midwife as well as each woman where
Right.
they want to attend the birth.
Okay. And then also now, when they do it in the hospital, do they still try to have that at-home setting when they do it, or not really?
Very often.
Okay.
The thing about midwives is we want women to have the kind of birth they want.
Right.
And we'd like to help to empower women to speak up and let people know what kind of experience they want. So most women, if given the opportunity, will choose a more home-like setting. In order to make a choice, it has to be an informed choice, right?
Right.
So we have to
Yes.
know what the choices are
Right.
before we can actually make that
Right.
choice. So we try to, expand women's knowledge so that they know what the choices might be, and then help her to give birth in the best way, that's the way that's best for her.
Right.
Respecting her cultural concerns and, her family preferences. Does she want her husband there, her mom there, and involving as many members of the family as she wants, and that makes her the most comfortable.
Right.
And really informing women about the benefits of normal labor and normal birth, and
Right.
only intervening. Our philosophy is to only intervene when it's necessary.
Okay.
To be able to screen women and identify which women do need those interventions,
Right.
and then we consult with our physician consultant, or we collaborate with other healthcare
Right.
professionals. But to try to really, that the goal is really a nice, normal, healthy birth.
Right. Okay, now walk me through, like, someone coming in, they're pregnant. Do you encourage them to do it, or basically depends on if they ask you about it? Do you kind of say that you're more into them having a midwife, or just actually regular birth?
Well, most women who come to a midwife come to a midwife because they want a normal, healthy birth,
Okay.
a natural birth as much as possible. But very often, say in the clinic setting, women will come in and we'll see them for their first visit, and then we offer them the option. Do you want to see a physician? Do you want to see a midwife? Do you want to see a nurse practitioner? And explain to them what the differences are so that they can make that choice.
Okay. Now, so in terms of nursing, my mom was a nurse, my aunt was a nurse. My aunt actually worked in the maternity section before she became ill. And how much difference is it just being the nurse and then to have those other credentials, as a midwife?
Well, there is a lot of difference because we really take on the responsibility of managing the pregnancy and managing the labor and actually doing the birth, delivering the baby, catching the baby, I like to say, because the mom does the delivery.
Right. At least we hope you catch them.
Yes, yes, that's always the goal.
Right.
That's always the goal. So there is a lot of difference. There's there's some overlap because both the nurse, say if there's a nurse in the room and the midwife in the room, we're both supporting the woman and helping her through the labor. But the difference is that we take on the responsibility of actually managing the labor and managing the birth. And we're with the mom afterwards. We help with breastfeeding. In fact, a lot of my patients would say to me, after the postpartum visit, they give birth, they go home. Then they come back in 4 to 6 weeks for that postpartum visit. And I say, okay, well, I'll see you then in a year. And they're like, I'm not going to see you again for a year because we get so attached.
Yes, it must be very comforting.
It's a very personal,
it is.
It's a very personal kind of care.
It is. I wish I had something like that when I was 22, because at 22, what do you know? You're so young and, so that would have been something that would have been nice. Yeah. Even though my mom is a nurse, but still, you have a little bit more training in terms of that. So now the other question is that what's the age differences in terms of people that come to you for that?
I've taken care of women from the age of 12 or 13, hopefully not pregnant at 12 or 13, but sometimes, all the way up to older women who are in their 40s having a baby.
Okay.
And we take care of, as I said, we do GYN care, so and well woman health care.
Right.
So for a lot of women, we are their primary health care provider.
Okay.
So I've taken care of women through menopause, all the way up till in their 60s and 70s. I still have seen women for care.
Okay, now you're saying, so is a GYN then, because if you're doing some of those same things, are you taking some of the same courses that a GYN would take?
Yes.
Okay.
That's part of our preparation when we go through our educational program. We're educated to do complete health care for women, as far as just not just the OB care and the pregnancy care, but the GYN care as well.
Okay, very interesting. Interesting. All right, so have some tea.
That's delicious.
It is. It is.
And the tea reminds me of we as midwives we very often utilize more holistic approaches to health and teas and things that can assist women with just minor problems, or if somebody's not sleeping well, we might suggest teas and those kinds of more holistic approaches to health care rather than going right to medication. Right.
Now, just curious if you know now how many midwives are in New Jersey, you said, versus in other states?
Probably over 150.
Okay.
We have 140 that belong to our organization, to the New Jersey chapter of the American College of Nurse-Midwives. But not every midwife belongs to the organization, so we know that there's more than 150 midwives in the state. We are doing about 8% of the births in New Jersey, which is about the same as in the country. The last year we have statistics for, I think, is 2012, and we did about 8% of the births. If you look at all births, but we know that there's a large rate of cesarean, a high rate of cesarean sections. So if you just look at vaginal births, we do about 12% of those. That's in the United States, that's over 300,000 births a year.
Right. I was going to say that I just read something that said around 310 births.
Right.
So that's interesting. Wow.
So we're busy.
Yeah, very busy, very busy. So what, just tell me a little bit more about, your journey with the whole midwifery. Anything that's interesting or anything that's, been very difficult, in terms of doing that?
Well, since I've been a midwife for so long, I don't usually admit how long I've been a midwife. I've seen a real change in the availability of midwifery care. When I first finished, there were no private practices for midwives in New Jersey, and now there are quite a few. So that's been something that I've noticed very definitely. We still, though, I think a lot of women still don't understand that midwives are available for care. I think I sent you some information that the national office has put out. It's called the Our Moment of Truth campaign.
Yes.
And that's trying to, an awareness campaign,
Right.
so that more women will know that midwife care is available.
Right.
Because sometimes people think, well, in order to have a midwife, you have to give birth at home.
Right.
You know, so they don't seek out a midwife because they feel that that wouldn't be for them, so that they don't realize it. Oh no, I can have a birth in the hospital and still have a midwife.
Right, right. So are they actually like maybe going into doctors' offices? Where are they going to like let people know about that information?
Not so much doctors' offices as just a media kind of thing.
Media.
We have the ourmomentoftruth.org is the website that women can go to.
Okay.
The New Jersey Midwives, NewJerseyMidwife.org is our website, and you can go on that and get more information about the midwives in New Jersey.
Okay.
And it has more information about Our Moment of Truth right there on the website, as well as information about midwife practices in New Jersey, how you can find a midwife.
Okay. Has there been any like real crises, in your 39 years?
Probably getting covered by health insurance was one big obstacle that we faced.
I can imagine.
Yeah. When I was a baby midwife, it was very hard to get insurance companies to cover care by midwives, but all the major insurance companies now cover midwives. Medicaid covers midwife care. So it's really, that has been a big step in order to get the care available to women. I can remember earlier on in my profession having women who wanted to come to me, and the woman would go to her insurance company and argue with the insurance company about why they should pay me.
Yeah, because we know the insurance companies, if they didn't have to pay for a lot of things, they really wouldn't.
Yes, I think we know that happens sometimes.
And it's really important that people should feel comfortable, especially giving birth, because that is a serious thing.
Yeah. And most of the time it's normal, and most of the time things go well. Sometimes things don't, so we always have to be vigilant. And I guess the other thing is that a lot of the laws were written and they just said physician.
Right.
And they didn't think about any other kind of healthcare practitioner.
Right.
So getting some of those laws changed so that we can really give complete care to our patients. For instance, being able to sign disability papers.
Right.
When a woman wants to go out on pregnancy disability. Took us years to get that.
I was going to ask you, how hard was it to make these changes?
It was not easy.
Now you had to talk to legislators and
talk to legislators and have a lobbyist to work, to work with us to talk to legislators and convince them that this was important to do.
Right.
But New Jersey has made big steps in this area, so that's a good thing.
So were you able to get a lot of your clients or people that were interested in that to go and speak to legislators as well? Doctors and others?
Yes. Many of the midwives in the state have been very, very active in this area, and in the years past had marches on Trenton. Have the pregnant women come to Trenton and say, we want midwives to be able to take care of us, and we want the laws to be expanded so that they can really give us complete care.
Right, and I know how important that is because I was part of the Junior League, and we had different issues that we used to go to Trenton and speak on different things on trying to change laws, whether for human trafficking, childhood obesity. We would go there and we would talk to them about different things. And also making those calls to legislators and senators and trying to get them to do these things. I understand the importance of what it is that we're doing. Right. So I know the task that you guys went through to do that, because it's a big, huge task to get laws changed.
Right, it is.
Yeah.
Because the legislatures have so much.
It's so much.
So much that people are constantly sending them information about this and that, and they can't keep up to date on everything.
Right. Right.
So we have to make sure that they are up to date on those things that are important, the causes that we are, we're really concerned about.
Right. And I think for them too, they're looking at cost. How much is it going to cost? That's a big issue. Whether the cost is going to go to the patient or it's going to go to the company. All those things are really important in them making a determination as well. So, it's not as easy as people think.
Well, I think we have a good argument because since women who are taken care of by midwives are much less likely to have a C-section and much more likely to have a natural birth, then that's very cost effective.
Yes, it sure is. So that's why you have to have all the ducks in a row, right?
Right.
Make sure when you're really prepared to go to them and tell them why you should really do this.
And we're finding out now that there's so many advantages to natural birth and to letting birth occur at its own pace, not inducing labor and letting labor go on its own. We're finding that not only are there benefits for the woman, there are benefits for the baby. There's a whole program now called I Want My 39 Weeks to encourage women and healthcare providers not to induce labor before 39 weeks. People used to think, oh, 36 normal pregnancies 40 weeks. Well, 2 or 3 weeks before that is okay, but we're finding out that those babies really need that extra time, those extra couple of weeks in there for the brain development as well as the lung development. So
okay, so that's going to benefit them in the long run.
Absolutely.
Because we're inducing it, and that can cause some problems then.
It can sometimes because induced labor is more it's not the natural way. It's more likely to wind up with a cesarean or more likely to have some complications. Anytime you use, medication interventions, all interventions have, both advantages and disadvantages.
Wow. I'm just like blown away because it's such an interesting field.
It's been a very interesting field.
So Linda, you said that you had worked in so many different areas. Can you just tell me a little bit about each of the areas and what made each area either nicer to work in or just something that's different about those areas?
Well, like I said, I worked in a large hospital for about 25 years, and I ran a couple of clinics, and one of them was the teen clinic.
Okay.
And that was very rewarding in many ways because these are young women, young girls sometimes that find themselves pregnant, and because as midwives we spend more time, talking to our patients and getting to know them, we really develop a very close relationship with them. And so it was especially gratifying to see them go through with a successful pregnancy because teenagers are a little bit more high risk.
Right.
But with midwifery care, they really do very, very, very well and have less premature birth and less small for gestational age babies. And one of the most rewarding things I think for that was having them grow up and then come back as adults.
Okay, wow.
And say,
very mature now.
Yeah, mature and tell us how much it meant to them, to have somebody really concerned about them and caring for them. And I think the other thing was having the private practice. I had a solo private practice for 10 years.
Wow.
So seeing those women and taking care of those women throughout that 10-year period, delivering all their babies and taking care of them in the interim and really becoming the family midwife.
Right, yeah, definitely. Like you said, you mother, sister, aunt, or whoever, you brought in a lot of them together.
Yeah, very often.
Family.
I felt like I was the family midwife.
Yes, that's for sure. So I know you probably don't even know, but just a wild question: how many women have you helped? Do you think that you've helped over all these years? It's a long time.
Several thousand.
Yeah, wow.
Several thousand babies.
That's amazing.
Yeah.
Wow. Now, is there any birth that stands out or more than others?
I think the first birth and the last birth are always, stand out right away. Both of those I kind of caught barehanded because the baby came out really quickly.
Oh my God. Just like,
yes, actually.
Wow. Oh my God.
And I had, I've had many patients that have been very special to me. It's kind of hard to pick out one.
Yeah, I'm sure. Because when you develop that relationship, like you said, it's hard.
Sometimes women have, do develop problems during the pregnancy, and as midwives, we always work in collaboration with the physician consultant.
Right.
So that even though the woman may develop some problems or some complications during the pregnancy, you and the physician can work together and you can still attend the woman's birth.
Right. Okay.
And so I think some of those women that, that I've taken care of in that way, they're very appreciative of the time and the effort that you put in and you spend with them. And so those turn out to be very special births sometimes.
Now, have you had anyone that have had to get a C-section?
Oh, yes. Oh, yes, absolutely.
Okay.
Absolutely. There are reasons that you need to do a C-section.
Right.
Sometimes babies get into trouble during labor.
Right.
Sometimes the baby's just too big for this mom.
Right. That's very true. Very true.
So, sometimes that's a necessity. But, one of the things that we do, one of the differences sometimes, not that we have for labor, one of our specialties, I guess I should say, is really coaching women through labor and helping them get up and walk around and get in any position that they might feel more comfortable in. When I had my private practice, the nurses always knew which patients were mine because they came in with their birthing ball.
Oh, really?
And they would sit on the birthing ball
gosh.
during the labor.
Right.
The particular setting where I was didn't have the option of the pool, so we didn't have tub births.
Oh, okay.
But they would get in the shower, and then they would sit on the ball, and they'd get in the shower and sit on the ball, and wear whatever they wanted. I didn't say, no, you have to wear a hospital gown. If you want to wear your husband's shirt while you're in labor, if that makes you feel more comfortable, that's fine. So really, helping women to be comfortable during labor. Sometimes you have to suggest, well, why don't you try this? Why don't you try that? Get on your hands and knees. Get on this side. Get on that side. Walk around a little bit more. Get in the shower. See how that warm water feels on your back.
Yeah, that's true.
So those are the kinds of things that we do to help women through.
Now, was the ball thing just for you in your practice?
No, a lot of midwives use the birthing ball.
Okay, because I know you were saying that they knew your patient because of the ball, so I wasn't sure in your practice.
It was in that particular setting.
It was, okay.
In that particular setting. I happened to be the only midwife at that time with a private practice.
Oh, okay.
But in larger practices, it's very common.
Okay.
It's like that big exercise ball that you see at the gym. It's the same ball.
Now, how does that help them? I guess what they're doing, slight bouncing on it?
It's kind of the squatting position is really the natural way to give birth. I mean, that's the way we all gave birth for hundreds and hundreds and hundreds of years, right? So when you sit on that ball, it's kind of like a supported squat.
Right. Okay, that's true.
And it's really very comfortable.
And does it help to,
well, the squatting position just kind of opens up the bones and helps the baby come down. So that's why it helps.
Yeah. I'll tell you, I was lucky though, because my mom had all her 3 children, 1, 2, 3. Mine 2 hours.
That's great.
It's so funny because my husband at the time, he went to move the car for my mother. Came back in, the baby was out. He was so upset, and even my sister, hers was about 2 hours as well. So I just thank God that I didn't have to go through so much pain. I mean, I was dilated almost by 6 by the time I got to the hospital.
That's terrific.
So I was lucky me.
Yes.
Because I had a friend that it was like that 24 hours. And then after that whole 24 hours of pain, they still had to give her C-section. And so that's like really horrible. So you would have been a perfect person to be there with her, to comfort her and, to help her through that.
Yeah, I've actually been with somebody in labor for 2 or 3 days sometimes. So
wow.
that's.
And now, did they have to get a C-section after all that, or it just came out naturally after that?
Both. I've had women that I've been in labor for a day and a half, and wound up with a C-section, and women that were in labor for a day or day and a half, and wound up with a natural birth. That. One of the things we encourage women too is to stay home as long as possible in early labor, so you can walk around and eat and be comfortable, and only come to the hospital when you're really in active labor. Of course, if you give birth at home, you don't have to worry about that.
That's for sure. That's for sure.
Stay home for the whole process. But if you choose to, give birth in the hospital, it's still better for that early part of labor to be at home, and because you can be more comfortable.
Right. Yeah. I was about 3 weeks early with my daughter. But it's funny, with my son, I went to the doctor the last day, and she says, well, if you want to have the baby the next day or 2, I can let that happen. And she kind of just opened it up a little bit, and that same night, he was born. So, that was, now would you consider that some kind of induced labor at all? Well, it's just, it was very slight, but no kind of medicine or...
Again, if you're full term, if you're 39 weeks or more, there's no reason not to. So that, it's again something that we can do. But again, what your doctor did was what we would do.
Okay.
We would say to the woman first, I can do this. This might help things along.
Right.
What do you think about that? Would you like me to do that? So what's very important for midwives is including women in all the decisions about their health care.
That's awesome. Well, Linda, thank you so much. It's been very enlightening. I've learned so much, more than I knew before, and I wish I had you when I was having my children. Someone like you. So thank you so much for coming on the show.
Thank you so much for having me. It's been delightful.
Yes, thank
and
you.
the tea is delicious.
Yes, thank you. Thank you. So everyone, thank you for coming on and watching the show. Until next time, Tea Talk, Real Talk. Bye-bye.